Okay, I would like to welcome everybody to the August 23rd Save a Life Narcan Training with Sheila Rickman. You are all in the right place. If you are here for RCHWN, I wanted to give a few reminders and updates. Usually I try to do it at the end, but I did not today. So as a heads up, we have our 2023 membership campaign is open. Refer a colleague or a CHW friend and let me know that, have them let me know that they referred you, or let me know that you're referring them, and you will get a gift in the mail from RCHWN for their new membership and renewal. We are looking for committee members for the 2024 Learning Collaboratives and the 2024 Conference Committee. At being part of the Learning Collaborative Committee, you would be helping pick out the topics for next year's learning webinars, locating speakers, and kind of orchestrating the behind the scenes. I figure it is your network, your organization, who better to pick out topics that CHWs want to hear about. So I was hoping that some of the members would be interested in joining one of these committees and kind of building your webinars around things that you are interested in, or speakers that you've heard in the past that you think would be a good fit for our organization. If you are interested in being a part of any of these committees, please reach out to me at rebecca@rchwn.org if you have any interest at all. I also wanted to let you guys know we have tons of items in our store, and right now I am offering a coupon code of UNITY, UNITY, and you will save 10% off your order. I also, as a reminder, if you are part of another organization or a community center or anything of the like, and you think that maybe you would like to co-host and partner on our 2024 annual conference and retreat, we are working on that right now. You can email me with interest and I can forward you over the form, or this is the address for the form to show interest in that event. I wanted to introduce today our speaker. She is also a member of RCHWN, and her name is Sheila Rickman. She is from Flint, Michigan, and her IM is an advocate. I will hand it over to you, Sheila.
All right. Hello, everyone. All right, so today I'm gonna try to get through this really quick, so that if you have questions or anything, there's time to chit chat at the end. So what we're gonna talk about today is overdose prevention, recognition, response. Can you click the next one? So Rebecca's gonna be sending you out a form, emailing it to you. This form I need filled out. This shows that you've taken this training and you received your kit, and up here it'll ask you like a kit number. Wherever you see the green arrow, that's what I will fill out, but I need you to fill out the rest of it. There's 3 pages, and some of it from after they ask for like your date of birth and stuff like that. The rest of these questions are statistical data that we need to do because we do give out free Narcan, and they want to make sure that we're reaching out to all community members and not just certain people. So on the second page, it's going to ask you like your health insurance, your economic status and stuff like that. I need you to fill all that in. Next slide. This last page of the form, you will initial every one of these boxes. This is exactly everything that we're going to be going over today. And where you see the green arrow, the lot number, the expiration date, I will be filling that in. You just need to make sure that you type in your name and today's date. Okay? All right, so let's get started. So today we're going to cover what naloxone is, some risk factors, how to recognize an overdose, how to respond, like by rescue breathing, and the SCARE ME acronym. So in my trainings, I always like to add some facts because facts help people understand more things better. So everything I get is from the CDC. So more than 932,000 people have died since 1999 from a drug overdose. And nearly 75% of those overdose deaths in 2020 involved an opioid. So like I am in recovery from heroin. Um this October I will have 30 years, and the heroin that I used is not even available on the streets anymore. Straight up heroin is not out there. Heroin cut with fentanyl is what you get on the streets now. There is no straight cocaine. Everything is mixed. So in 2020, Americans aged 12 years and older, there was 37.309 million people were current illegal drug users starting at age 12. Look at that. 12-year-olds are currently using illegal drugs, right? Just in Michigan, there was 2,011 people who died from an opioid overdose in a year. 76.1% of those deaths involved a synthetic opioid, which is like fentanyl, man-made. So how I told you that you can't get straight up heroin or straight up cocaine, everything's mixed with fentanyl. Even marijuana, if you don't get it from a dispensary, and I'm here to tell you that there are some shady dispensaries, just like there's shady party stores that sell to minors and stuff like that. There's shady dispensaries that's adding stuff to the marijuana to get that little bit better high. And so everything is laced with fentanyl. When I was doing um, Meals on Wheels, we were going around neighborhoods, and some of the little teens over here in Mount Morris, they said that they didn't want to stay for lunch because they were going to do some perks. So that's Percocets that's been dipped in fentanyl. So these babies are out there, and it's different time than what it used to be. Because like I remember growing up, we all tried like, let's try some marijuana, right? You know, I smoked my first joint with this old lady. She taught me, you know. Now you can't even do that. Your kids can't even experiment or test anything because of the fentanyl that's being put in everything. So what this breaks down to is every 5 minutes there is a drug overdose in the United States. Every 5 minutes someone is dying from an overdose. And overdoses can be preventable. Okay, next slide. So what is Narcan? Narcan is a nasal spray that counteracts the life-threatening effects of an opioid overdose. This training was designed for first responders, but you do not have to have any medical knowledge to administer Narcan and save somebody. Next slide. So Narcan only reverses the effects of an opioid overdose. So say like
The boss brought that in.
so say like you have a fifth of tequila that you've drank, and then I shot up some heroin, right? And I overdosed. Well, if you Narcan me, that's going to reverse the heroin. However, I'm still going to be drunker than a skunk from that fifth of tequila. Okay, so it doesn't touch anything else but the opioid. Say like I was having a heart attack and somebody Narcan me, it's not going to help or hurt my heart attack. It would only affect if there was an opioid in my system to reverse it. Okay. Next slide. So this is what your Narcan is going to look like. I have one right here. See if this one's got plunger down. So inside here, I don't know if you can see this, but the plunger's down. When I tell people when they get it out of their kit, I tell people to keep their hand on the side because that plunger it's like a one and done. You hit it, you've just wasted all the medicine. So I always tell people to keep their hand on the side until they get it in the nostril, then shoot it. Right? It's just like Flonase. Also in your kit, because you'll get two 4 milligram cartridges. You're also going to get a keychain that has a barrier mask in it and some gloves. I think the ones I have now are black though instead of this red. Um, but it's just a Red Cross bag that has a barrier and gloves in it. And then you'll also get like a thumb drive, flash drive, however you want to call it. Sorry, my hand's stupid. Um, of the PowerPoint slides and the video and stuff like that will also come in your kit. Okay. Okay. So what Narcan does is when you use an opioid, you have all these little receptors in your brain that tells your heart and lungs when to breathe because it's connected to your central nervous system. When you use an opioid, they go on to these receptors, and if enough of those receptors are blocked, that's what starts your overdose. So when you use a nasal Narcan, it goes through cell membranes directly to the brain, lifts the opioid off those receptors, which hence reverses the opioid because then the person's able to breathe again on their own. I need you to click the slide. All right, so then now we're up to the slide. So fentanyl, because fentanyl is like 50 times more potent than morphine, to put it in a perspective. Fentanyl is harder to reverse. So your 2 doses that you get in your kit might not be enough to reverse that overdose. You might need more. Okay. And Narcan lasts for 30 to 90 minutes. And that just depends on, that's the half-life of it. So it just depends on the potency of the opioid. So here's a visual of those little receptors in your brain. And the orange is the opioid sitting on the receptors. And like I said, if enough of those receptors are blocked, there's your overdose. Because opioids are sedatives. You might have seen it on your pain pill bottles. It says may cause drowsiness. And that's because they're intended to slow everything down. But if you take more opioids, it slows everything down to the point that you're not able to breathe on your own or your heart to beat on its own because everything's slowed down. Next slide, please. So when you use the nasal Narcan, it goes up under the opioid and removes it from those receptors and puts like a protective barrier over the receptor for the next 30 to 90 minutes. And that depends on how much of the opioid the person used, their tolerance level, how much is metabolized in their system, and the strength of the opioid that they used. So all those things play an effect of that 30 to 90 minutes. Okay. Next slide, please. So here are some common names for some opioids. You know, like you heard of heroin and Demerol, Darvocet, Dilaudid, methadone, Tylenol 3s, Percocets, Percodans. All those are different opioids. And you can see they come in all pretty colors. And that little picture up there, it shows you those are lethal doses of heroin. And then you got the fentanyl. Carfentanil is like 100 times more potent than fentanyl, next to a dime. And carfentanil is out on the street now. Also stuff mixed with zizapine. I think that's how you say it. I don't say it right because I don't know. But that's an animal tranquilizer. And we're seeing here in our clinic, people are coming in with big sores. To me, it reminds me a lot of like the flesh-eating bacteria, because when they use this animal tranquilizers for rhinoceroses and elephants and stuff, it does work as like a little booster for the opioid, because the Xylopan is not a sedative and it's not an opioid, but it acts as a booster. So, like, say that I was using fentanyl and then I used some of the xyloline, then that would like boost it. So the effects that I would have would be greater. I would have to use less fentanyl to get that greater high because of that animal tranquilizer. But what it's doing is leaving big sores in people's arms. It's like their flesh is just being eaten away from it, and people are dying from that. It's very nasty. You can Google that. Those pictures are pretty nasty though. Next slide. I always like to add this one in too. This just shows people a lethal dose of heroin, and that's not the heroin that's on the street right now. That's just straight heroin, not mixed with fentanyl. And then on the right is the fentanyl. Both of those are legal doses for a grown man to be an overdose. Now, that little tiny bit of fentanyl is being added to the heroin to make it lethal doses. And what the problem is, it comes in the mixing. Um, these drug dealers are not scientists. They do not proportion everything out at all. So say like you bought a bag of dope and they wanted to add enough fentanyl in it. Their intent is not to kill you. Their intent is to give you a better buzz so that you keep coming back for more. But there's where the problem is. So you got this bag, and then they say, okay, we got this quarter, so we're going to put this little tiny pinch of fentanyl in there. And then we're going to mix it. Voila, there it goes. See, their mixing process is wrong. So I like to use the analogy of making chocolate chip cookies. Whenever you make chocolate chip cookies, not every cookie is going to have exactly 5 chocolate chips, right? Some cookies might get 3, some might get 12, some might not get any at all, right? And that's because the mixing, there's no scientific way to make sure that every cookie gets exactly the same amount, right? Some cookies don't even get none. So that's kind of way it is when they're mixing fentanyl in with these other drugs. Their mixing process. They're not rocket scientists, and they're adding it and just do it and passing it off. So say like me and Wendy go in halvesies and buy a bag of dope. And then me and Wendy, we each roll a joint out of that bag and we smoke it. Wendy was so lucky because she didn't get any chocolate chip cookies in hers. But when I hit mine, that one hit had all the fentanyl in it and I overdosed. People are not understanding that. They think that it's not going to happen to me. My dealer doesn't do that to me, but it does. It's the mixing process. It's nothing personal. They're just trying to get it so that you buy more. Next slide, please. So some risk factors for an overdose: mixing drugs. Like that pill bottle shows, may cause drowsiness. So if you're mixing your opioid with other sedatives like Dilaudid and Demerol, alcohol, that's also a sedative, that increases your risk, as well as benzodiazepines, benzos. They are a sedative as well, and already having a sedative with the opioid that lowers down everything, that puts you at a greater risk. Next slide, please. So some different other risk factors is your tolerance level. People don't realize that your tolerance level from opioids starts dropping after 72 hours. So say like little Johnny got busted for selling and he gets locked up and he goes to jail for a couple weeks. Johnny's always did $20 worth of heroin every day and he functions and nobody knows any the wiser, right? So he gets out of jail. 2 weeks is a lot longer than 72 hours, right? So Johnny thinks that, oh, I can still go back to using my $20 a day because I've been doing that all along. Well, he did that $20 and that can put him at a greater chance because his tolerance level has already reduced. That's why a lot of times when people get out of jail, there's a lot of overdoses. That's one of the reasons why we put our Narcan vending machine at the MTA bus station downtown, because a lot of the people, when they're incarcerated, they want to get out of town when they're out, and they get their fix after being incarcerated before they hop on the bus, and they're overdosing in the bathroom. because they don't realize how quickly that tolerance level drops. Next slide, please. Unfamiliar supply changes in quality. Okay, say you always buy your stuff from Little Johnny. Little Johnny doesn't add nothing. He's straight and narrow, good guy. Just wants to make sure you're happy and safe. Well, like I said, Johnny went to jail for a couple weeks, right? So he had to go to Little Pookie. And Pookie mixes fentanyl with everything in hers. So that just increases your chances of an overdose by getting it from somebody else that the quality is different. Having someone else inject you. You have control when you're injecting yourself, and you can feel when you have had enough or you're good. If by having somebody else, they can push too much into you, and that can cause you into go into an overdose state. Next one, using alone also puts you at a higher risk factor. We're not promoting group usage. We're not promoting usage at all. But if you use alone, you're guaranteed that you do not have a first responder at all. There's no one there to help you, save you, give you Narcan. Okay, so some of the key messages for risk factors: make sure you don't use alone. You know, your consumers, make sure you educate them and let them know that, have someone there, it's their body, their choice, but make sure that they're not along and not mixing anything, right? And that tolerance level starts dropping and continues to drop after 72 hours. All right. And the changes in quality. Just like, if you always went to the same bar, they always make you a rum and coke and it's just perfect. But you go down to the bar down the street and, oh, they make theirs really, really weak. So you got to drink more, right? But this other bar makes them super strong. So your same 4 drinks doesn't cause you to get drunk. Now it's only 2. So you just got to be careful that the quality of your drugs that you're using. Next slide, please. So how to prevent deaths. Education. Just like you guys take in this class today, the information that you're getting today, you're gonna pass on to other people, and that's gonna educate more people. Eliminating barriers to treatment. So here at the health center, we try to remove all the barriers. Narcan's about $180 a box. We're giving it away for free to remove that barrier, so that everybody has access to Narcan. We also try to educate and let them know about the availability of detox centers that we have here in Flint and how to get into treatment centers. Here at the health center for our patients, we do our own recovery for all meeting every week, which we provide a support group for just our patients where our health coaches who are in long-term recovery as well run meetings to give them ideas and stuff, because a lot of people don't realize that the AA and NA groups, if you go there and you tell them that you're in some kind of MAT program, they don't feel that you're really in recovery, and they treat you differently, and they sometimes tell you can't come there because they don't feel that you're totally clean. Next slide, please. How to recognize an overdose. Things, like people don't get drunk like right away, right? It takes a little bit. Same thing with an overdose. It might not happen very quickly unless they're shooting up and they shoot up too much really quick, and then the needle will still be in their arm, right? So a Caucasian person will have blue lips around, blueness around their lips or their nails. They'll have slow or shallow breathing. They make a gurgling sound. Some people know that as a death rattle. And they're unresponsive. So like when you call their name, they don't respond to you. You might have heard the term nodding out. A lot of times when people are on opioids, they can be talking to you like this, and then they just come back talking to you and they don't even realize that they were out. And that's when you want to start paying attention. So I always like to share this little story because everybody can relate. You know how like when you go to a family function, everybody has that like one family member that like gets super drunk until they pass out at every family function, Uncle Bob. So We all know that Uncle Bob gets drunk at every single function, right? And nobody worries about him. They just watch and wait for him to pass out. And then every so often, somebody will walk by him and hip check him or something like that. And he'll carry on and throw his arms around, maybe cuss you out a little bit for disturbing him, but you know he's okay, right? So, what would you do if you walked by Uncle Bob and you hip checked him and you shook him and there was no response? That's when you start going to get worried, right? So, that's when for an opioid overdose, that's when you want to first react, is when they are no longer responsive. So if you're watching them and they're nodding out, you want to stay with that person, keep trying to engage with them to keep them going and keep them alert. The moment that they become unresponsive, that is when you want to react. You know, you can check someone with a sternum rub, push right here. Sometimes if it's a woman, it's hard to get to that sternum because of their breasts. I've had to train children how to deliver Narcan to their parents, and sometimes kids don't have enough strength to push right there. But you can take those same knuckles and rub right here on your top upper lip. And by doing that, it will cause a reaction to get them to react to see if they're responsive or not. Children can do that. Y'all can try that and see that it works. Makes you want to lick your lips or something. Next slide. We're going to skip the video. It'll be on your slide, and also on the side of your Narcan kit, there's a QR code that says it takes you to the video. So you can see that. So now we're gonna go over the SCARE ME acronym. S for stimulation, C for calling, A for airway, rescue breathing, E for evaluate, M for medicate, and E for evaluate and support. So we're going to go through those steps, because if you can remember SCARE ME when you're in a situation that's scary, then that should help you be able to see if you're able to do that. So, right, so next slide, please. So for the S and the C in the SCARE ME acronym, you want to make sure they're unresponsive. You can do the knuckle rub, you can shake them, you know, but the first thing you want to do as soon as they're unresponsive is get out your cell phone, put it on speakerphone, and call 911. Tell them that you have someone that is not responsive. If you know that they're using, then tell them that, because that'll help also. Any information that you can give them. And if you have your Narcan on them, you can tell them that you have Narcan and you know how to use it. Okay. Next slide, please. So they're going to ask you to make sure the airway's not blocked, because somebody could have fallen out and they could have been just choking on a chicken nugget, right? So they're going to have you check the airway, and this is not CPR class, not first aid. So the 911 operator will tell you how to tip their head back and clear their throat, make sure there ain't nothing caught in there, like their chicken nugget from lunch or something. Next slide, please. If you have to leave a person at all to go get your Narcan or anything like that, they're going to ask you to put the person in the recovery position. And they'll tell you how to do that by bending up their knee and what for to put them on their left side. So they'll tell you how to do that because it helps them breathe a little bit easier. Next slide, please. So the R is the rescue breaths, right? So when you use an opioid, like I said before, it slows everything down and it stops your breathing, your heart rate, and your lungs. So the 911 operator is probably going to have you do CPR and mouth to mouth. That's why in your little kit, I'm giving you a barrier to protect yourself, right? Because it's very important for that oxygenated blood to get through the person's body. So if you're giving mouth to mouth or you're giving chest compression, that's circulating oxygenated blood, and brain damage does not start until 6 minutes of no oxygenated blood, right? So if you even use your Narcan and the person doesn't come back, as long as you keep doing the CPR, that will help the person keep that oxygenated blood flowing. Okay. And if you have to do the mouth to mouth, as I said, this is not first aid class or CPR class. They will tell you exactly how to do it. The next slide, this is the steps. I've included it in it, but this is not your, we're not teaching that. So, but it is in your slides. Um, next slide, please. The E in the scare is to evaluate. Are they breathing on their own? Yes. Then you stay with them and evaluate them until help arrives. No, this is when you're going to administer the first dose of Narcan. So remember, take it out, put your hand on the side of the container, insert it into the nostril, plunge the plunger, right? You're going to wait. It says like 1 to 3 minutes. 90 seconds. If they ain't responding, you're going to hit them again. But in the meantime, the 911 operator may have you do mouth to mouth and chest compressions again. All right. Because it's very important for the oxygenated blood to keep going. Right. Next slide, please. You want to stay with the person. And if they don't respond after 1 to 3 minutes, you need to give them a second dose. In the meantime, continue with that. If they wake up or when they wake up, explain to them what happened. Explain to them that you gave them Narcan. Okay. Some of the side effects of the Narcan is withdrawal symptoms. I'm telling you right now, your 2 doses is not going to send someone into withdrawal. I'm telling you that right now. With the stuff on the street, this ain't even going to probably touch the overdose. So I just want you to be very clear with that. We have had to use, I know one of my health coaches, he's administered 14 doses in the parking lot to save someone, waiting for paramedics with the hospital just kitty corner from us. So that didn't even send the person into withdrawal. Okay. But the person may experience a headache, nausea, vomiting, and they say a person can be aggressive. I try to look at it from a different perspective. Have you ever like taken a little cat nap because you've been working your tail off and you did like that power nap and then someone startles you and wakes you up and then it takes you a couple seconds to get your bearings? Where am I at? What am I doing? Now imagine that happening to the person that's in the overdose and they come to. A, they don't know that they overdosed. Only thing that they know is that they were high, feeling good, and now all these people are up in their face and in their business. Get out of my way, get out of my way. I'm trying to figure things out, right? So I don't look at it as aggression as much more as trying to get their bearings and figuring out what's going on, right? Because they don't realize that they died. Next slide, please. You want to make sure that you discourage the person from using more drugs. Remember, I told you that Narcan has a half-life of 30 to 90 minutes, right? So at any time in that, if they use more, that's going to make it so they could go into another overdose really quick, and it'll be harder to reverse because now there's more opioids in their systems, right? The opioids, your pain pills, when you get them at home, it says take every 6 to 8 hours. That's their half-life. So 6 to 8 hours versus 30 to 90 minutes, there's a big difference there, right? So we just want to make sure that they know not to use again, right? Next slide, please. So administering Narcan does not replace emergency medical care because as quick as they come out of the overdose, they can slip right back into it. Hence the reason why we say don't leave until the ambulance comes. But I found this out that we're not allowed to make them go to the ambulance. We can't hog tie them, hold them down, make them do anything. If they don't want to go, they don't have to go, but it's best to try to advise them to get them to go because like I said, the opioids that they're using last longer than the Narcan, and they can go right back into an overdose as soon as the ambulance leaves. Next slide, please. We don't want to leave the person alone because they could stop breathing again. You don't want to put them in a bathtub because they could drown. You don't want to induce vomiting because they can choke. And you don't want to give them something to drink because they could vomit, right? The opioid is in their bloodstream. It is not in their digestive tract. All right. Don't inject them with anything besides the Narcan, such as salt water, other drugs, or milk. And about a month ago, I was at a church doing a group Narcan training, and I got to the slide, and one of the people being trained there says, "Really, you don't give milk? We've always done that." So no, you do not put milk into their system. And it can make things worse. And lastly, you don't want to kick their chest because it won't open their heart valves or anything else, but it can hurt them. Um, so those things on the list, I wouldn't have to put it there unless people actually did that. So people do that stuff, so please don't do that. So I'd like to share something else. A lot of people think that Narcan is only for people that are drug addicts, you know, that are at risk of an overdose. But let me tell you, anybody is at risk. I have been promoting, my company has purchased, we call them Nalox boxes to give to businesses to have an extension to their first aid kit. Um, that has Narcan in it and um defibrillator masks and stuff like that to try to help prevent it. Um, my mother had COVID really bad. She almost died from it, but she suffers from long-term COVID, so she has like the brain fog. She had to have her toe amputated, and she's really good about her medicine. She has them all in her pill cases. But when she got the pain pills, it said take as needed. So she did not put them in her pill case because she did not want to um become addicted to them because like me, she's very mindful of that. So my mom got up and she took her medicine, right? She took her pain pill. Well, because of the COVID brain fog, she forgot. 20 minutes later, she was in pain and she forgot that she had taken them. So she took her pain medicine again. And then she repeated that process because she was still in pain. And my mother overdosed. My mom did not intend to overdose. Luckily, my nephew and my brother that lived there was both Narcan trained, and they was able to revive my mother. And she is okay. But my mom is 72. She's not even really that old. But because of the COVID brain fog, she forgot. Her intent was not to overdose, but she did overdose. And I can tell you this right now, it takes 23 minutes from the time you make the 911 call to get an ambulance to my mother's house. So if my nephew and my brother wouldn't have Narcaned my mother would have died. So I want you all to know that it's not just for drug addicts. That is somebody that was not intending to overdose. Her intent was not to hurt herself. Her intent was to get rid of the pain that she had. And because of the brain fog, she forgot. Now we have a new system to do it up, but that is how that rolls. But there's also other things too. Have we've all been given pain pills, right? And we don't take them all. So we put them in the medicine cabinet to save them for a rainy day, right? So we can self-medicate ourselves and treat ourselves without having to go to the doctors, right? Now, what if one of your babies grabbed one of those pain pills? Hmm, they could possibly overdose. Wouldn't it be great to have Narcan right there? Um, Kids are bringing drugs to school, candies that's been dipped in fentanyl. You know, drug addicts have babies too that they drug pushers and they send that to schools to try to get other people addicted, right? So your baby comes home from school and says, "Look at this, little Johnny gave me this candy," and eats it and overdoses. Wouldn't you like to have Narcan on you? I believe every household should have Narcan on them. So I think that's pretty much of my slides. Um do I got any questions?
I
Yes,
have,
Miss Andrea.
yeah, I have one. So curious because I know that a lot of places are using the dispensaries or like the little, where you can go and like get the Narcan kits through the
A
little
vending machine?
dispensaries. Yes. How
Mhm.
often do they have to be refilled? Just curious. Like, are you
So
finding
at
that they're
ours, ours at the downtown bus station, when we first put it in, we was filling it up every single day. Now we go about 3 times a week to fill it up. And also on our vending machine, um, at the bus station, besides Narcan, we have fentanyl testing strips
Nice.
so that people each envelope has 5 test strips and they can get those too. But we ended up we go about 3 times a week to fill the vending machine because it's
That
pretty
that
much tapered off.
but that seems like still so many like people out there that are needing those kit. You know what I mean? Like it's alarming to me to hear the statistics that you shared at the beginning about want like every so many seconds or what, the deaths or whatever. But it's amazing to me that it's just
So,
so rampant, you know?
yes. So, in the beginning of August, so August 9th, my health coach, Ross, went and gave us the count. Since we started this in February, the beginning part of February, we have distributed 2,092 Narcan kits, and each kit has 2 doses, so that's 4,184 doses. We've also passed out 1,459 fentanyl test strips, and that's an envelope. And each envelope contains 5 test strips, which totals out to be 7,295 test strips that we have passed out since the beginning of February.
And you do this in your county, right? Genesee County?
Yep,
So
that's
I
the only
think
vending machine that we have.
But I think of like Genesee County, and yes, it's pretty populated, but I think that in Michigan alone we have 83 counties, and you in just one county have have impacted that much. I can
Mhm.
only imagine our numbers out of every county being similar to that. Like it's just I'm just really in awe, number one, at the work that you guys are doing, because I think it's amazing and I believe that it's so needed. And those numbers speak volumes for the impact that you guys are creating. But it amazes me that the need is so great. And I think of that if we did that in every county in our state, our impact would be just that much deeper. So
Right.
congratulations to you, kudos, because
Thank you.
this is amazing. Yeah, but those numbers, to me, that data is
Mhm.
super impactful for me to hear today. I think that's amazing. So yeah, thank you.
Yeah, and we also here at the health center, we do 2 trainings a month. We have went to doing one virtually and one face to face. So we can get back because we used to only do them face to face pre-COVID. But we also go to community events like this week, Monday and Tuesday, and tomorrow we're going to be at the Genesee County Fair and we're passing out Narcan there too. Um, and then this weekend we do other community events, and if they request Narcan, we go there. Because August is overdose awareness month. So we try to make it rain with Narcan.
Well, and
April, did
oh, sorry.
you? You're good.
One more comment.
Sorry.
Just the fact that you also shared the fact that this, I think that the stigma around Narcan and these life-saving measures are just for individuals who are in active addiction is really kind of false, right? Because like you said,
Correct.
how many times have we been given strong pain medication due to a toothache, or
Mhm.
I know that I was given it after like my cesareans, and like you said, you
Yep.
save it for a rainy day,
Yep.
and you
Yep.
just really never know. So that
Yep.
kind of opened my eyes as well to think, oh, and if children don't realize what they're taking, right?
Yep.
So yeah, that's impactful as well. So again, thank you for sharing those pieces that I didn't realize, that I'm not really like necessarily always, paying attention to. So that's really awesome. Thank you.
Yep.
Yeah, I think it's really important too because like in the news a couple of months ago, they were showing how they're putting these opiates in and it looks like candy. Wow. So like if it can easily be mistreated or it can get in the hands of a child. And can you imagine that dose being given to like a 10-year-old or 11-year-old? And it's just something that they wouldn't even be aware of just because it literally looks like Skittles or it looks like Smarties.
Exactly.
And I think
Exactly.
knowing that and like how far it has gone from like, because I remember being younger, people would have certain things around, but you're aware of it. But now it's like you really don't know what's in anything.
Right. Yeah.
April, what's
Um,
your question?
I wanted to know, are those machines available in Tennessee? The Narcan
Well,
vending
so
machine?
we had a grant that allowed us to purchase it because the vending machine was about $5,000. And because of the grants that we have, the Michigan government, MDHHS, if you are a train the trainer in Narcan and you are giving away free training, they give you Narcan. So they're supplying our Narcan because Narcan's like $180 a box, right? So
Okay.
you would have to check with your local area and see if there's grants available to purchase the vending machine
Okay. Thank
and
you
stuff
so
like
much.
that. If you need information on like where we purchased ours and stuff, all you guys gotta do is email me and I can send you where we got our vending machine. But it was like $5,000, but we had a grant to pay for that.
Okay. That'd be great.
Yes,
I
Miss
have another
Andrea.
Are you aware of any coalitions or anything we can do as far as like being a part of maybe on some of those some of those meetings and things on how we can better advocate and maybe start to like expand this work in other counties for other folks?
Well, there should be coalitions in every county. Like here in Genesee County, we got Greater Flint Health Coalition, we got the COC, the Continuum Care Coalition. So every county's got coalitions. So you just have to get in touch with your county's coalition and see what you can do. If you can't find a coalition or anything like that, partner up with different agencies who's got the CHWs, that knows all the different resources, who's out there for substance use disorder treatment. Maybe get in touch with the different recovery um places and detox centers and stuff like that. Um so that you can start making things and advocating to have that brought to you. Because it is a nationwide thing. The federal government's getting involved now. So there's more grant opportunities for other places to do like what Michigan's doing with the free Narcan and stuff like that. Okay, so I was looking at the chat box and I was seeing Andrea, the horse tranquilizers. Yes, that is just like the xylopine, the animal tranquilizers, the horse tranquilizers. Those are all boosters that intensify the effects of the opioids. So say like you smoked one joint that had some fentanyl in it. If you use the animal trank, you only need like a quarter of that joint to get the same buzz as the whole joint. So it's like boosting the effects of that.
Well, it was the weirdest thing because normally we go to like a farm and home store, right? So we usually it is under a locked cabinet, but you can go get the attendant. Well, there it was like out. So we had to actually go to the counter. They took us into like a back like manager office and had to like literally walk us out with it and like purchase it, and then they had to take a bunch of information. It wasn't that we were purchasing even the tranquilizer, it was actually for our mayor because of her, but all the stuff was locked up and it was in a completely separate room. It was the most bizarre thing. And they said it was that people were stealing it and that a lot of them were using apparently these medications to mix with street drugs. This is in my little community.
Yep. People don't realize that it's everywhere. It doesn't discriminate. It doesn't matter if you're in a rich neighborhood, a poor neighborhood, you know. My son is a recovering addict and he started out because of pain pills. You know, he hurt his back when he started working at 17 at Lapeer Industries. Then he got addicted to pain pills. Then he went to a rehab facility and learned how to shoot up heroin instead of getting off the pills. And then 10 years later, my son is finally clean and doing very well. However, you know, it doesn't discriminate against nothing. It doesn't matter what your race is. It doesn't matter your social class. It doesn't matter. It doesn't care. And you know how they have functioning alcoholics, functioning addicts as well. You know, people just take just enough to keep them going and people don't realize, but yes, they are addicts. And there's a lot of older people that are addicts. You'd be surprised.
Yeah,
You
I
know, so
think
it does not discriminate.
I think I probably would because you know, because my husband is also in active recovery and he's done very well for the last 8 years. But I still am so shocked by all of these numbers and the impact that it's having on all of the individuals. And like you said, at a much younger age. When Eden, our daughter, is now going to be she's 15, going to be 16, but she had to go to a procedure at U of M when she was 11. They gave her a pregnancy and a drug test. And when we asked them why, they said because you'd be amazed at the 9 and 10-year-olds that come in and we can't administer any of the medications that we have to do to do the procedure because for fear of causing an overdose or causing another if there's other substances in there, and we have had that a lot. My husband and I were both very shocked at that.
Yes. Like I said, I do a lot of events out in the community. There's a lot of housing projects that I go to, and I'm not trying to say anything negative about housing projects at all. But I have had to give Narcan and Narcan trainings to more babies from the housing projects than anywhere. Their parents sign for it and their parents want them to do it because their parents are the ones using. But I can tell you right now, you are what your environment is. And if that's what you see your parents are doing, that's what you're going to do. So I try to educate them. I pass out my card a lot to those babies. I was at a Halloween event last year with a pastor going to some of the housing projects. And when I pulled up, the pastor was out there trying to talk to these children, and none of them had nothing to do with him. So I walked up, and of course, I'm in my little Mad Hatter costume. They all come running over to me. And the pastor asked why they weren't going over to him. And they said, because this is our mama, Sheila. She gave me her card and said that if I needed her, I could call her because she truly cares about us. So that tells me that I'm hitting those babies and they know that I'm sincere. So they want to, you know, so just reaching out makes the difference.
Well, and I want to start crying right now, just so I know, and I've been talking a lot, but I just want you to know that like it takes a special person because I don't know if I would even be able to do that just because it would be ultra like maybe it's just because I haven't myself experienced some of those things, right? I know that probably my husband could do something like that, but it just breaks my heart to think, like I said, when they had said that they had to give our daughter a drug test, we were like, I don't, do we look like, it doesn't matter. You don't have to look like anything. You
Nope.
don't, people don't look a certain way, right?
Nope.
And it wasn't
Exactly.
even like I was trying to say, like, you're just like trying to be discriminatory at all by that people look a certain way, but I was just thinking like, we don't have and it is,
That wouldn't
it's
be
one of those
us.
things. Yeah, I found myself like really having to like check myself because I was like, you're better than that. You're in this industry. You know that things don't look a certain way, right? Like,
Well, like it's not a secret, about me or my family members or anything like that. But I'm here to tell you, last school year, my grandson, 13 years old, we get a call from the school. He overdosed on a weed pen at school. 13, and does he know all about it? Yeah. His mother is the director of intake at Odyssey House, a big rehab facility, So he was just trying it because they got a new game out with the vape pens that has marijuana in it called the blinking game, where they suck on it until it stops blinking, till it stops blinking. Well, that was enough to when it quit blinking and my grandson stopped that he passed out cold because of too much THC intake at one time. We were just very lucky that it only had THC in it and there was no fentanyl in it, because I was just did a training a few weeks ago that showed how kids can go right on the internet and order right from Amazon. There's no age quota or nothing like that to get stuff to refill their own vape pens, that they can add their own stuff to it. And it tells you even how to mix it to make your own with cooking oil and everything that you have in your home.
That is crazy to me.
Yeah, it's all
I didn't know
they
if
can
you
get all that.
read, somebody just wrote, I used to work in an adolescent SUD residential treatment program. The youngest we could take was 12 years old. And unfortunately, we got a few referrals on kids that age over the years. So here's a question, because I have young children and I have seen like fentanyl overdoses at our high schools and junior highs, and they're usually the athletes, which from my generation, our athletes, I always thought were like the cream of the crop, the healthy people. But a lot of them I found are overdosing on fentanyl on pain meds because they get a sports injury, their coaches or their doctors prescribe them a pain med, they get addicted, and then they start buying it off the street, which is like really sad to me that in this generation and all of our technology and all of our smarts, we aren't smart enough to find other ways to treat somebody with pain and different things.
Yep.
Well, and I think of like my husband is a peer counselor and peer coach. He went through a training to use acupuncture. Why are we not using more of those types of things when it comes to trying to manage pain, like acupuncture and some of the other things that, you know?
We have Serenity House here in Genesee County that does a lot of holistic treatments. But a lot of people don't believe in holistic treatments. A lot of people don't even want to admit that they have a problem.
Yeah, that's true. You got to admit it, right?
Yep.
In order to get the right treatment, right? So, or
And
any
then you have to
treatment.
want it,
Yeah.
because it's not easy. You know, like I said, in October, I'll have 30 years. But some days are better than others. But there's other days, even after 30 years, that I just want to throw in the towel. Oh, it's a very hard thing to overcome. So giving someone support and showing them that you care and that you're there, you know, we all can't walk in everyone's shoes and understand what their thing is. I know what made me go use, and I know that. I don't know what anybody else's is. There's different paths to recovery as well. I tried to go to AA meetings and NA meetings, went to 3 NA meetings, and they told me that I would not be in full recovery until I relapsed. Knock on wood, I have not relapsed and I never went back to that. However, I went to intensive therapy because I had a lot of things and trauma that I had to deal with.
Well, as
I-
always, Sheila, I love you, my dear. I could sit and talk to you for hours about all these things and pick your brain. Um, I'm amazed by the work that you're doing. And I really appreciate your time today. And it was nice to connect and learn some new things. So this is amazing.
Let's
Thank you
try to
again.
keep updated info. Just everybody just send me, Rebecca's going to send you the form. I need that form back ASAP. Your training is not considered complete until you take this training, you fill out the paperwork, and I ship your kit.
I will be sending out that form later today. Also, as a reminder, if you have not been receiving the emails that come out the Monday before as a reminder for these, or reminders of what's happening with RCHWN, you might want to check your spam for the info at RCHWN email, because we do use a mass mailing server and sometimes it gets shucked to spam. But you also will be getting this sent to you later in a YouTube version that members can watch for free. So it is something you can watch, and eventually I open it to the public, but I usually have about a 6-month lag there. So if you have the link, you can watch it though, just like any past one from the beginning of the year and last year. Andrea, on a side note, I do need to get with you about one of your presentations that I'm hoping you still have the slides for. Because I can't find the recording, but somebody was asking if they could get it from you.
Yeah, if you want to connect with me after this,
Sounds great.
I'm available.
And once again, Sheila, your story is amazing. You inspire me every time I talk to you. And honestly, I look forward to lunch one of these days when my children are back at school.
Thank
Mine
you.
starts tomorrow.
Mine does not start till Monday. Thank you for all the members that have came in for the Narcan training webinar. We appreciate you. We would not be the network we are without you. It does take a team to do this network and to get all the learning collaboratives together and everybody joined in. If there's questions, things you wanted to ask, but you didn't feel comfortable asking on the webinar, when you receive the email from me, I'm sure you can email Sheila any of those questions and she'd be more than happy to answer them, have a conversation with you, have a meeting with you, whatever you would like. Once again, thank you very much for joining RCHWN today on our webinar. Thank you, Sheila, for donating an hour of your time and your expertise in Narcan and your lived experience. To all the CHWs on the call, you're amazing. We advocate for you, we respect you, and we celebrate you as often as possible. Thank you very much, everybody. Have a great rest of your day.
Thanks, you too. Bye-bye.